We are all living through an exceptional time in our life. Millions of us are sitting at home practicing social distancing and have had to adjust our lives to a new norm. Handshake, goodbye kisses, and hugs seem to be a thing of the past. The world is switching to alternative ways to greet each other due to the rapid spread of COVID-19. This pandemic has affected the population worldwide. As future healthcare administrators working in the healthcare field, we have to learn to adapt to these changes as COVID-19 is not going anywhere soon. Healthcare administrator jobs have always been essential in the success of a healthcare business plan, employee management, and operation efficiency. Healthcare administrator jobs are changing to cope with the impact of COVID-19 has had on hospitals, clinics, nursing homes, and other healthcare facilities. As healthcare workers, we have to start planning for the long-term goals. This includes the slow reintegration of scheduling to address those patients that need to be rescheduled for services, maintaining appropriate staffing, and preparing the clinic, hospital, and healthcare facilities ahead of time.
We can all help prevent the spread of respiratory viruses like COVID-19 and the flu. Some measures you can take are wash your hands frequently with soap or use hand sanitizer. Please remember, do not touch your face with unwashed hands. COVID-19 can spread through droplets in the air, which is why face masks are critical. Wearing a mask provides two levels of protection. First, it blocks droplets that could carry germs from leaving the mask. And second, if any droplets do get out of the mask, they are blocked from entering the nose or mouth of the other person wearing it. You can also help prevent the spread of COVID-19 by social distancing. When going outside, please try and stay at least 6 feet apart from other people. Also, if you're sick, stay home. By staying home, you help prevent other people from getting infected. Finally, cover your mouth when coughing and disinfect areas and objects that are frequently touched.
In this class, we have learned that public health is very controversial and that this pandemic can lead to a mental illness without you noticing it. While masks are most certainly an effective public health measure for preventing and slowing the spread of COVID-19, many people still refuse to wear it out in public. They claim that this is going against their rights. We have also learned that nearly half of all Americans will develop at least one mental illness during their lifetime. And at this specific moment is when cases of depression can arise. Although there is many controversy, we have been taught that these set of rules are put in place for a better tomorrow.
If there's something to learn from this pandemic is that public health agencies need more funding. Public health awareness helps and reduces the intensity of the spreading rate and reduces the death rate. I'm thankful for all healthcare professionals that have been fighting this virus from day one. Their work is appreciated, and as a future healthcare administrator, I am proud to be part of this industry. Going through this experience, the hardest part was not knowing when it would be over. I think COVID-19 is here to stay, and we must keep ourselves and others safe by following CDC guidelines. Right now, it is all we can do as a community while waiting for the development and distribution of a vaccine.
In my experience, one of the hardest things is not being able to socialize with my friends and family like I used to. Having to see them only through a screen is not the same as spending quality time with them. But the hardest thing is just the fact of being paranoid all the time. As I go to work or just out for groceries, I feel unsafe all the time as you never know who might be infected with the virus. As Eliani mentioned, all we can do is hope for a vaccine that is effective against the coronavirus and it can slow the spread for a better tomorrow.